if you're standing in your kitchen every morning, popping open a row of vitamin bottles, and quietly assuming that every single one of those pills is doing something helpful for your body, I need you to pause for a moment. Because for adults over 60, some of the most commonly recommended, most trusted, most heavily marketed vitamins on the shelf are not just unhelpful. In several cases, the research is telling us they may actually be dangerous. I'm Dr. Emma Carter, and this channel exists to bring you the latest evidence-based research on senior health, simplified and made practical for adults over 60. Hit subscribe right now if you want honest science, not supplement industry marketing. That one click helps me reach more seniors who need this. So, let's get right into it. There's a stubborn belief that has been drilled into all of us for decades. If a little of a vitamin is good, more must be better. And if it's sold on the shelf at your local pharmacy or your favorite big box store, it must be safe. That thinking might have been reasonable when you were 35 years old with a fast metabolism, healthy kidneys, and a liver that could clear anything you threw at it. But the aging body is a completely different physiological environment. Your kidneys filter less efficiently, and your liver processes fat-soluble compounds more slowly. Your bones respond differently to minerals, and that means the exact same supplement that once seemed harmless can now quietly accumulate and cause real damage. Today, I'm going to walk you through 5 specific vitamins and supplements that the current research suggests most healthy adults over 60 should either stop taking altogether or approach with far more caution than the label admits. I'm going to explain what each one does inside your body, what the studies actually show, and what alternatives, if any, make more sense at your stage of life. And by the end of this video, you'll have a clear, specific list of questions to bring to your next doctor's appointment. Because this is the kind of conversation that could genuinely add years of good health to your life. Before we start, one important disclaimer. I am not telling you to throw open your medicine cabinet and start dumping bottles into the trash tonight. If a physician has prescribed a specific supplement because of a diagnosed deficiency, that's a completely different situation, and you should absolutely not stop without talking to them. What I'm covering today applies to the millions of seniors who are taking these supplements on their own initiative because a magazine article, a friend, or a TV ad convinced them years ago that it was a good idea. All right, let's get into it. Vitamin E is probably sitting in 9 out of 10 senior medicine cabinets right now. For decades, it was sold as the ultimate anti-aging antioxidant. It was going to protect your heart. It was going to protect your brain. It was going to keep your skin youthful. And when something gets marketed that aggressively for that long, it becomes very hard to convince people to reconsider it. But the research on high-dose vitamin E has taken a genuinely alarming turn. A landmark meta-analysis published in the Annals of Internal Medicine looked at data from 19 clinical trials involving more than 135,000 participants. The finding was striking. Adults taking 400 international units or more of vitamin E per day had a statistically significant increase in all-cause mortality. Let me translate that. People taking high-dose vitamin E were dying earlier than people who weren't. That is not a small red flag. That is the researchers waving a fire extinguisher. Here's what's happening biologically. Vitamin E is a fat-soluble vitamin, which means it doesn't just wash out of your body in your urine the way vitamin C does. It accumulates in your fatty tissues, in your liver, and in your bloodstream. At the low doses you'd get from a normal diet, that storage is manageable and beneficial. But at 400, 800, or 1 IU per day, which is what many popular supplements contain, you start crossing into a range where vitamin E stops behaving like an antioxidant and starts behaving like a pro-oxidant. It actively promotes the very kind of cellular damage it was supposed to prevent. For seniors, there's an additional concern that most doctors don't discuss. High-dose vitamin E thins the blood. If you're already taking a low-dose aspirin, a blood thinner like warfarin or Eliquias, or even a fish oil supplement, adding vitamin E on top of that stack significantly raises your bleeding risk. I've personally seen patients come in with unexplained bruising, nosebleeds, and even minor internal bleeding that traced right back to a vitamin E supplement they'd been taking for 15 years without a second thought. Margaret was 68 when she came into my office worried about bruises appearing on her forearms with no memory of bumping into anything. She was on baby aspirin, she ate salmon twice a week, and she had been taking 800 IU of vitamin E every morning since her 50s because a health magazine had once told her it was good for her heart. When we stopped the vitamin E, The bruising resolved within a month. Her cardiovascular markers didn't budge. She had been paying for a supplement that was quietly harming her without offering any measurable benefit. Comment below right now. Are you currently taking a vitamin E supplement above 200 IU per day? Just yes or no. I want to see how many of you this applies to. This one is going to be uncomfortable for a lot of viewers because calcium has been marketed to women over 50 as an absolute non-negotiable for the last 40 years. If you're a senior woman, there's a very good chance your primary care physician recommended you start taking 200 milligrams of calcium a day the moment you hit menopause. And on the surface, that logic makes sense. Bones need calcium. Aging bones lose density. So more calcium equals stronger bones, right? Except the research that actually support that conclusion. And worse, it's revealed a serious cardiovascular concern that many prescribing doctors still don't know about. A large analysis published in the British Medical Journal followed calcium supplement users over several years and found that women taking calcium supplements without co-administered vitamin D had roughly a 30% higher risk of heart attack compared to women who got their calcium from food alone. Additional meta-analyses have suggested about a 15% increase in overall cardiovascular disease risk in healthy postmenopausal women taking calcium supplements. Here's why. When you swallow a 500 or 600 milligram calcium tablet, your bloodstream receives a sudden calcium spike that your body was never evolutionarily designed to handle. Food-based calcium releases slowly across hours. A pill dumps it all at once. That spike appears to contribute to calcium deposits in arterial walls, which is exactly the opposite of what you want happening in a 70-year-old cardiovascular system. Your bones don't magically absorb extra calcium just because it's floating in your blood. They take what they need, and the rest has to go somewhere. And increasingly, the evidence suggests some of it goes into your arteries. There's also the underappreciated issue of kidney stones. Excess supplemental calcium is one of the leading contributors to calcium oxalate stones, and passing a kidney stone at 72 is not something anyone should have to experience. Now, does that mean calcium is bad? Absolutely not. Dietary calcium from yogurt, cheese, sardines, leafy greens, and fortified foods is genuinely protective and is not associated with the same cardiovascular risks. The problem is specifically the isolated, high-dose pill form taken without a diagnosed deficiency and without vitamin D and vitamin K2 to direct that calcium toward the bones instead of the arteries. Robert's wife Eleanor was 71 when a routine coronary calcium scan revealed a score that had jumped nearly 40% in 3 years. She had never smoked, her cholesterol was well controlled, and she exercised regularly. The one variable that had changed. Her doctor had put her on first 200 milligrams of calcium citrate daily 7 years earlier. When we reviewed the current evidence together and transitioned her to food-based calcium plus vitamin D and vitamin K2, her follow-up scan 2 years later showed her calcium score had stabilized. Not reversed, but stopped progressing. Vitamin A gets a lot less attention than the previous two, which is precisely why it's dangerous. It hides inside multivitamins. It hides inside beauty supplements marketed for skin and hair. It hides inside cod liver oil. And because it's a fat-soluble vitamin, it accumulates in your liver year after year. And most people have no idea how much they're actually taking. Here's what the research says, and this one honestly surprised me the first time I dug into it. A study published in JAM found that women who consumed high levels of preformed vitamin A, roughly twice the recommended daily allowance, had significantly higher rates of hip fracture. Additional research has demonstrated that for every 1 standard deviation increase in serum retinol, the overall fracture risk climbed about 26%. That is a stunning finding because it means vitamin A, the same vitamin marketed to seniors for eye health and skin health, may be actively contributing to the fractures we're most trying to prevent. Here's the mechanism. Vitamin A, in its retinol form, appears to interfere with vitamin D's ability to help you absorb calcium, and it also directly stimulates the cells that break down bone tissue. Your body is constantly balancing bone building and bone breakdown. Access vitamin A tips that balance in the wrong direction. Combine that with declining estrogen, reduced physical activity, and the normal age-related loss of bone density, and you have a recipe for a hip fracture waiting to happen. I mentioned in an earlier video that hip fractures in seniors over 70 carry a 1-year mortality rate approaching 30%. That statistic bears repeating here. This is not a minor cosmetic issue. A supplement that quietly raises your fracture risk is a supplement that can, quite literally shorten your life. Beta-carotene, which the body converts into vitamin A as needed, is a much safer form because your body only converts what it needs. The problem is preformed vitamin A listed on labels as retinol, retinol palmitate, or retinol acetate. If your multivitamin contains more than about 3,000 IU of retinol per day, that is a conversation worth having with your physician. Check your labels tonight. Pull out every supplement bottle in your cabinet and read what's actually in it. You may be genuinely shocked at how many of them contain vitamin A that you didn't know you were taking. This one is the sleeper hit of dangerous senior supplements, and it's the one that catches the most people by surprise. Vitamin B6 has a genuinely wonderful reputation. It supports nerve function. It helps with mood. It's involved in energy production. Doctors sometimes recommend it for arthritis, for carpal tunnel, for premenstrual symptoms, and for general brain health. But here is the cruel irony. High doses of vitamin B6 can cause the exact condition it's often prescribed to prevent. Peripheral neuropathy. That is nerve damage in the hands and feet, which shows up as numbness, tingling, burning sensations, unsteady walking, and in severe cases, permanent nerve injury. The Australian Therapeutic Goods Administration has actually issued formal warnings about this. Research has shown that dosages above 250 milligrams per day taken over months or years can lead to progressive sensory peripheral neuropathy. And here's the kicker. There are documented cases of neuropathy developing at doses as low as 50 milligrams per day when taken long-term. Many senior, marketed B-complex supplements contain 50, 75, or even 100 milligrams of B6 per capsule. Let me put that in perspective. The recommended daily intake for adults over 50 is about 1.7 milligrams for men and 1.5 for women. So if you're taking a B-complex that contains 100 milligrams of B6, you're getting roughly 60 times the amount your body actually needs. And the excess doesn't just sail through and exit gracefully. It builds up in the sensory nerves and can cause damage that in some cases is only partially reversible. Frank was 69 when he came in complaining of numb feet and a burning sensation in his fingertips. He'd been to a neurologist. He'd had an MRI. He'd been tested for diabetes, for B12 deficiency, for thyroid problems. Everything came back clean. When I reviewed his supplement stack, he was on a Senior Energy B-complex that contained 100 milligrams of B6, plus a separate stress supplement that contained another 50. He'd been on that combination for 4 years. Within 6 months of stopping both, his symptoms improved dramatically, though a small amount of numbness in his toes persisted permanently. If you're taking a B-complex right now, pause this video and go check the milligram content of the B6 in it. Anything above 10 milligrams per day taken long-term is worth discussing with your doctor. The fifth one on the list is iron, and this is the one where I see the most meaning mistakes. Iron feels intuitive. Iron makes blood. Blood carries oxygen. If you're tired, more iron must equal more energy, right? Except for the vast majority of adults over 60, that logic is dangerously backwards. Unlike most nutrients, your body has no efficient way to excrete excess iron. Once it's in, it's largely in. It builds up in your liver, your heart, your pancreas, and your joints. And with each passing year, that iron accumulation contributes to what researchers now describe as one of the underlying drivers of biological aging itself. Iron in excess is a powerful pro-oxidant, meaning it accelerates cellular damage, promotes inflammation, and appears to worsen the risk of cardiovascular disease, certain cancers, and neurodegenerative conditions like Alzheimer's. Here's a critical fact most people don't know. Postmenopausal women no longer lose iron through menstruation, which means the natural iron regulator that protected them for 30 years is gone. Combine that with a daily iron supplement, and iron levels can climb quietly into a range that increases disease risk without producing any obvious symptoms until damage is well underway. For men over 60, the situation is even more clear-cut. Adult men rarely become iron deficient unless there's an underlying medical problem like gastrointestinal bleeding that absolutely requires investigation, not a supplement. Taking iron without a documented deficiency in an older man is not just unnecessary. It's actively harmful. A comprehensive review has associated long-term iron supplementation without deficiency with a 3- to 4-fold increase in cardiovascular risk compared with the general population. That is not a subtle risk. That is a meaningful, quantifiable danger sitting inside a bottle marked Energy Support. The signs of iron overload are sneaky. Fatigue, joint pain, abdominal discomfort, elevated liver enzymes, changes in skin color. Every single one of those symptoms can easily be misattributed to normal aging. And by the time it's properly diagnosed, real organ damage may already be present. Before starting iron, get a full iron panel. Ferritin, serum iron, transferrin saturation, TABC. If your ferritin is above 100, iron supplementation is almost certainly the wrong direction for you. If it's above 200, you may need to consult a hematologist to discuss iron reduction rather than iron replacement. So if I'm telling you to reconsider 5 of the most popular senior supplements, what does the current evidence actually support instead? Let me be specific. Vitamin D3 remains one of the best supported supplements for adults over 60, particularly for bone health, immune function, and muscle strength. Most seniors are deficient. Most don't get enough sun exposure, and a simple blood test can tell you exactly where you stand. A dose of 1,000 and 2,000 IU per day is reasonable for most adults, but the correct dose really should be personalized based on your blood level. Vitamin K2, particularly the MK7 form, is emerging as an important partner to vitamin D and calcium. It appears to direct calcium into bones and teeth and away from arterial walls. That's exactly the opposite of what excess supplemental calcium tends to do alone. Magnesium is genuinely underappreciated. Most seniors are deficient, and magnesium is involved in over 300 enzymatic reactions in the body, including blood pressure regulation, muscle function, sleep quality, and glucose metabolism. Magnesium glycinate or magnesium citrate at 200 to 400 milligrams per day is well tolerated by most people. Omega-3 fatty acids from a quality fish oil, particularly EPA and DHA, continue to show benefit for cardiovascular health, brain health, and inflammation control. Look for a supplement providing at least 1 xalozine milligrams of combined EPA and DHA daily. Vitamin B12 becomes increasingly important with age because our ability to absorb it from food drops significantly after 50. Deficiency is common and can present as fatigue, memory problems, and neuropathy. A methylated form of B12 taken sublingually or as an occasional injection is often what older adults need. Notice what all these have in common. They address deficiencies that are actually documented in the senior population. They're not shotgun approaches. They're targeted, evidence-based, and personalized. So here's exactly what you should do with this information. First tonight, pull every single supplement bottle out of your cabinet and lay them out on your kitchen counter. Write down each product, the specific dose, and how long you've been taking it. You may be genuinely surprised at how much is in there and how long some of them have been sitting in your daily routine without ever being reevaluated. Second, cross-reference every label for the 5 ingredients we discussed today. Vitamin E above 200 IU, calcium above 500 milligrams taken as a supplement. Vitamin A in retinol form above 3,000 IU. Vitamin B6 above 10 milligrams. And iron in any dose if you haven't been formally diagnosed with iron deficiency anemia. Third, write down 3 questions to bring to your next doctor's appointment. Ask, can we run a complete micronutrient panel including ferritin, vitamin D, B12, and a comprehensive metabolic profile? Ask, given my current medications and my age, are any of the supplements I'm taking increasing my risk of falls, bleeding, or cardiovascular events? And ask, which of these can I safely stop, and are there any that I should taper rather than stop abruptly? Fourth, do not stop everything at once. That's not the message here. Some supplements, particularly those recommended for a specific diagnosed condition, may be genuinely important for you. This is about having a real conversation, not a knee-jerk reaction. Fifth, start tracking. Keep a simple log for the next 3 to 4 weeks. Note your energy levels on a scale of 1 to 10, any new bruising or bleeding, any digestive symptoms, and any changes in balance or numbness in the extremities. That log becomes powerful evidence for your physician to work with. Before we close, I want to make something clear. Everything I've told you today applies to healthy adults over 60 taking these supplements on their own initiative. If you have a diagnosed deficiency, if you've had bariatric surgery, if you have a malabsorption condition, if you're on medications that deplete specific nutrients, or if a physician has specifically prescribed one of these supplements for a documented reason, the calculation is completely different. Do not stop anything unilaterally. Talk to your doctor first. The concern we've discussed today is the vast, silent middle of the senior population who took vitamin E because a magazine said it was good for their heart in 1998, who started calcium because their friend was taking it, who added a B complex because it promised more energy, and who never once asked whether any of it was still appropriate for the body they have today. You deserve a supplement routine built on your current blood work, your current medications, and the current evidence, not on decades-old marketing. If your energy has been dropping, if you've been bruising more easily, if your balance feels off, if your bone density scans are worsening despite calcium supplementation, If you have unexplained tingling in your hands or feet, you now have specific, evidence-based information to bring into your next appointment. Comment below with which of the 5 supplements we discussed today you're currently taking. Comment reviewing mine if you're planning to bring this list to your doctor. I read every single response, and your question genuinely may become a future video. If someone you love is taking a handful of vitamins every morning without any real oversight, please share this with them today. One conversation armed with the right information can genuinely protect them from harm they don't even know is happening. I'm Dr. Emma Carter. Subscribe if you haven't already, because next week we're covering the 3 prescription medications that quietly deplete essential nutrients in seniors and what to take to protect yourself if you can't stop them. I'll see you there. Take good care of yourselves.